I'm going to try to help you guys understand what depression, anxiety, bipolar, and schizophrenia looks like in adult populations. So our learning objectives today is that we're going to provide an understanding and explanation on what psychopathology is exactly and how it is displayed in an adult population, to provide an understanding of the origins of psychopathology, how it is diagnosed by mental health clinicians, and the best practices in treatment for adult populations, as well as to recognize the signs in oneself or a loved one and how to receive proper help. So what is anxiety? In the psychological world, we call it generalized anxiety disorder, or GAD. It's a mood disorder that is characterized by multiple and or non-specific worries that interferes with a person's life in some way. So this is not your normal just being worried, but this is when it completely just interferes with your everyday functioning. GAD involves chronic worrying, nervousness, and tension. It's a general feeling of dread or unease that colors your whole life. This anxiety is less intense than a panic attack, but much longer lasting, making normal life difficult and relaxation impossible. So many people don't realize that it's impossible to be relaxed and anxious at the same time. So one of the great techniques that we use for people who suffer with anxiety is to teach them relaxation techniques. So worry versus anxiety. The difference between normal worrying and generalized anxiety disorder is that the worrying involved in GAD is excessive, intrusive, persistent, and debilitating. So again, it interferes with your everyday life. So there are a couple of emotional symptoms, and for the sake of time, I'll just say a couple of them. You have a constant worrying running through your head. You have feelings that the anxiety is uncontrollable. There's nothing that can be done to stop the worrying. The intrusive thoughts about things that make you anxious. You try to avoid thinking about them, but you can't. So those are some of the emotional symptoms. Then we have the behavioral symptoms. This is an inability to relax. Have you ever just met someone and they're just so jittery and just so anxious and you can't calm them down no matter what you try to do? This is what the behavioral symptoms of generalized anxiety disorder looks like. They can't enjoy quiet time or to be by themselves. They have difficulty concentrating or focusing on things, putting things off because they feel overwhelmed, and avoiding situations that make them feel anxious. The physical symptoms. You have the feelings of feeling tense, having muscle tightness or body aches, having trouble falling asleep or staying asleep because your mind won't quit, feeling edgy, restless, or jumpy, stomach problems, nausea, or diarrhea. So again, the treatment for generalized anxiety disorder, the core symptom of this is chronic worrying. So basically, as clinicians, we try to decrease the worrying, basically. So it's important to understand what worrying is, since the beliefs you hold about worrying play a huge role in triggering and maintaining GAD. And cognitive behavioral therapy is the preferred treatment for most anxiety disorders. And if you're unaware of what cognitive behavioral therapy is, cognitive stands for our thought processes and our behavior. So what we do is, in CBT, as we call it, is that we try to help you monitor your thoughts in order to change your behaviors. What is depression? Depression is a mood disorder that is characterized by feelings of intense sadness, including feelings of helplessness, hopelessness, and worthless that last for many days to weeks, interfering with normal functioning. Now, this is not your everyday of just feeling blue. This is something that is interfering with your life for an extensive period of time. Everybody has a down day every now and then. So that's, you wouldn't be diagnosed as clinically depressed just on having a day of fun. So causes of depression. It has many possible causes, including faulty mood regulation by the brain, genetic vulnerability, stressful life events, medication, and medical problems. So it's believed that several of these forces interact to bring on depression. And most of you hear that depression is a chemical imbalance, but it really is a holistic problem. Yes, chemical imbalance, the genetic component really is there, but it really is a holistic situation. So some of the things that we do in our lives may bring on depressive situations. or our everyday stressors maybe get to a point to where they become overwhelming. It's something, say for instance, if you lose your job. So the normal stress of